Amlodipine Overview. Amlodipine Besylate is a calcium channel blocker. It lowers the blood pressure, relaxes heart muscles and dilates the heart blood vessels to prevent spasm. It has been known since the late 1800s that calcium influx was necessary for the contraction of muscle.it inhibits the calcium influx across the cell membrane. It was approved by FDA in July 1994. Clinical use.its long duration of action allows once daily dosage. Indication. Amlodipine Besylate is primarily indicated in conditions like angina pectoris, essential hypertension, hypertension, prophylaxis of angina, vasospastic angina. Contraindications of amlodipine. Amlodipine Besylate is contraindicated in conditions like Sinoatrial node disease, hypersensitivity, aortic stenosis. Common side effects of amlodipine. Swelling of the legs or ankles, edemas. One of the most common amlodipine side effects. It happens because amlodipine dilates your blood vessels, which improves blood flow. Dosing: adults 5 to 10 mg. Once a day. Your doctor may adjust your dose as needed. However, the dose is usually not more than 10 mg per day.